head of the nation's top public health agency on Wednesday announced a shakeup of the organization, saying that it fell short responding to COVID-19 and needs to become more nimble. The plan changes at the Centers for Disease Control and Prevention, or the CDC, leaders call it a reset, come amid criticism of the agency's response to COVID-19, monkeypox, and other health threats. The changes include internal staffing moves and steps to speed up data releases. The CDC's director, Dr. Rochelle Walensky, who you heard in the intro, told the agency staff about the changes on Wednesday. It's a CDC initiative and was not directed by the White House or any other administration officials, she said. Now, the Atlanta-based agency with a $12 billion budget and more than 11,000 employees is charged with protecting Americans from disease outbreaks and other public health threats. It's customary for each CDC director to do some reorganizing, but Walensky's actions come amid a wider demand for change. I wonder why. I wonder why there's a bigger call for change. Huh? I've made no secret of my disagreements with the CDC since this whole COVID pandemic has started. To give a little bit of background, this show, Issues and Answers Friday, I was here at the very beginning with Kathy Kelly and Levita Sparks Wade and Mr. Johnny Rucker. We did our first show on February 14th, Valentine's Day 2020. Yes, February 14th, 2020. That was right at the very, 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 very beginning stages of the pandemic. We didn't even know there was a pandemic yet. We were all in here having a gay old time, eating Levita's brownies and having a good time here. Nobody's wearing a mask. Nothing was going on because there was a sort of blissful ignorance going on about what was about to happen to us at that point. And over the next subsequent weeks, I'd say within 2 or 3 weeks, all of our lives changed dramatically. Dramatically. You know, here at WLTH, I went from having a full studio full of people, Levita, Kathy Kelly, and Johnny Rucker, we all having a good time in here, to being the only person allowed here in the studio because if you're watching the stream, you can see I'm running the boards too. I'm doing everything, okay? I'm doing everything, okay? If y'all want to call Marion Williams and tell him to give me a raise because I'm doing everything, go ahead and do that, okay? Well, I was the only person allowed in the studio at that point. And it just happened very quickly, in a matter of a few weeks. And a lot of it was because of the CDC directives and our government's directives on how to handle this pandemic. We were all social distancing at that point. And from the very beginning, our government and the CDC specifically screwed up the response to COVID-19. They really did. From day one, I've played many times on here, Dr. Fauci, in early 2020, telling everybody not to wear a mask.
There's a lot of confusion among people and misinformation surrounding face masks. Can you discuss that?
The masks are important for someone who's infected to prevent them from infecting someone else. Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill.
Now, see, I ran with that, okay? I was here at the station when Dr. Fauci was saying that, and I remember going on the air here in, I want to say March of 2020, early March, before, again, I started wearing a mask. Now, I don't think any of you have ever seen me without the mask at this point. I think very few of you probably remember seeing me without a mask, but at the time, I was listening to the CDC and Dr. Fauci and all these people saying, don't wear a mask. Don't wear a mask. And so I told you guys, don't wear masks. Don't wear masks. The health providers need masks, but you guys don't. And then a few months later, it's like, oops, everybody wear a mask. Everybody wear a mask. Wow. Boy, was my face red. So we went from nobody should be wearing masks to everybody has to wear a mask. Now, Dr. Fauci later on admitted that he was lying about telling people not to wear masks because he wanted to make sure that healthcare providers had enough masks and that doctors and nurses and first responders had enough masks before the public at large made a rush to get masks, which is completely understandable. But the problem that Dr. Fauci and the CDC had is they treated us like children. We have a right to know that wearing a mask was going to help protect us in some capacity. We had a right to know these things. We had a right to know. Don't talk to us like children. Don't lie to us because you think it's in our best interest. Now, what the CDC, Dr. Fauci, all these people should have done is say, look, we don't have enough masks for all the first responders and for the public. So what we're going to do is we're going to reserve as many masks as we can for first responders. The rest of you can start making your own masks. They're not as good as the surgical masks that we wear or the N95 mask, but they are better than nothing. They could have said that. People could have been wearing their own masks. They could have been making their own masks. Again, wouldn't be perfect, wouldn't be great, but if it prevents a few more infections when the disease was obviously at its most dangerous, early stages of the pandemic, what's the harm in that? Talk to us like adults. Don't talk to us like children. All right, let me take this call right here. Hello, caller.
Hey, Scott.
What's up?
It's something everybody misunderstands. People just don't understand.
Yes.
3 years before this COVID-19 came, that Jewish rabbi got on national TV and told everybody that this COVID-19 was coming. He told everybody the whole purpose of this COVID-19, the 7 families wanted 5 billion people off this earth. It's too many people on this earth.
Ooh.
I don't talk to you all about this.
Yes.
Okay, well, let me move on further. Look, no matter what that doctor said, he was ordered to say this. If not, he was going to be 1-to-1 dead. But look, 5 billion people, I'm telling you, and it's still going on. That's the way, look, all the way back from the Bible days, all the way back to Pharaoh coming forward. When too many people was on this earth, what did they do? They started wars and killed people off. When too many people was on this earth, look, Vietnam War, World War I, World War II, look, all of this was thinning out the whole entire world. I'm telling you.
Yes, I'm listening.
This Jewish rabbi started and told everybody. So when this COVID-19 came in, look, the African doctor got on national TV and spoke live. This black African lady.
Yes.
She spoke live. She said, look, this COVID-19 coming in, all this is blood clot. It's coming in, what it's going to be nothing but blood clot, clot of blood. That lady told everybody. All you got to do is just start doing 2 vapor aspirin a day, and you can keep your body, you can keep your blood running thin. However, you can go to your regular doctor and get hydroxychloroquine, but hydroxychloroquine is expensive as hell. So this man that was doing all that talking, once the 7 family ordered, look, we already know who the 7 families. We already know the 7 families. We know the Rothschilds is one of them. I'm quite sure now Bill Gates one of them. We know Elon Musk is definitely one of them. Jeff Bezos on Amazon. These are the seven families. This is running the world. Too many folks that don't want to share the wealth. That's just the way it is. You never heard me talk about this before.
Oh, I've heard you talk about it before.
But that's what's going on. So when this man got on radio, on national media speaking all of this, he was ordered to say that. If he don't say it, what you think will happen to him? He's gonna be gone on before.
Oh yeah.
Look. I'm telling you, man. That black African doctor, everybody better thank God for what that lady did. Look, all this running. Look, okay, one more thing. Pfizer,
yes,
Johnson & Johnson, all this vaccine they made. She said Pfizer, Johnson & Johnson, all this vaccine. Look, these pharmaceutical companies know they mucked up and messed up, and the mess do not work. But what they had to do, they got to tell a lie. They make their $100 billion back. So they lied to make the $100 billion back and give people them shots, and people still dead from them shots.
Yes.
But however, ladies, all you got to do just to keep the blood thin, 2 paper aspirins a day. But you can go to your doctor. He can prescribe you hydroxychloroquine, but that's some expensive mess.
Well, thank you for your call. I got another caller, but thank you for always staying engaged and educating the public.
Well, you seem like you're the only one that listens to what I said. Now, bye.
All right, now. Hello, caller.
Hello, Scott. How you doing?
It's all good.
Yeah, interesting. But you know what? Now,
is this one of the mothers of the show?
Huh?
Is this one of the mothers of our show?
Mothers. Well, I call on in the morning a lot.
Yes. Okay.
But anyway, I was calling every once in a while. You know, I like to listen to you and Pastor Dale. But you know what? The thing that I was thinking about, now, see, I caught COVID. I really did.
Yeah.
And I don't know how I did it. I really don't, because I wore the mask. I was at the schools. I was in the classrooms.
Well, that's how you caught it. You were in the classroom.
Well, see, they had to wear masks.
Yeah.
Everybody had to wear masks. And no one else in the classroom did. And I didn't even know that I had taken the vaccines. I really did. I had taken the vaccines. And I didn't even know. I just remembered that morning when I was going to work that morning, you know how you just felt kind of not feeling like going. Right. That's kind of the way I felt. I didn't have any pains, any aches, anything like that. But when I got to work, I remember my friend said to me, she said, maybe you should just go down to the nurse. And when I went to the nurse, she said, you know, you tested positive. I said, really? I already had the vaccine. Now, like I said, I already had the vaccines. Now, I did. And now I've known of several people who have gotten it, so it's not a joke. It is real.
Oh yeah, I know it's about 6 people who died from it.
Yeah, that's what I'm saying. It is real. And it's not a matter of because I know I was listening to, I'm not thinking of the young man, one of the young men who used to host one of the shows. He was talking about how his brother had gotten it and how sick he was, and he was in rehab at that point, and a lot of it, how it affected him. But I'm just saying, you know, but I just think that people in authority, and I do agree with you, those people like Dr. Fauci and those could have treated everybody like adults.
Yes, they should
and told
have.
people the absolute truth.
Yes.
Because you know what, you're thinking that all of this stuff, this gear that you're putting on every day is helping you. When actually it was doing little to none. But now we do understand, and I still wear them. When I go out in public and somewhere, I do. I really do, because you never know what people have or who they've been around.
Yep.
And that's what we were saying. You know, you don't know who's been around who, and you know, sometimes you're asymptomatic. You don't have anything. Like I didn't.
Right.
I really didn't, so I do appreciate it. I agree with you. This is we are to have conversation, so I will be calling in more. I just like to listen.
Look, you can feel free to call in at any time.
I know.
I love hearing from you.
And you know what? And I love your happies.
Oh, well, thank you. I got a good one. I've got a good one today. And
you know what? I wanted to ask you this too. Your music that you play when you're going off and coming back in, what is that?
Which one? Let me. You know, it's. Yeah, this is the main theme of our show.
Okay, now it's another one that you play. It's another one that you play. when they be coming back from off of the
Oh
commercial.
yeah. Oh yeah. You know, virtually all of the.
It's like it seems like it's jazz or something.
Oh,
I don't know.
You know,
I know it's no music, it's no singing or anything like that. You know, it's that da da da, and then it.
Oh yes. You know, with the bumper.
The bumper. Yeah, I like that.
Yes. That's Curtis Mayfield.
Really?
Yes. Curtis.
I don't mind.
Yes, Curtis Mayfield and the Impressions. Man, oh man.
Oh, okay.
Yes.
Okay. I said, no, that sounds nice. Okay.
Yes. Thank you for your call.
Okay, Scott. Bye-bye.
It's all good. Yeah, I absolutely agree with our caller. You know, they did not give us a full accounting for everything, and the CDC has shot themselves in the foot over and over again. They shot themselves in the foot over and over again just by being disorganized and dishonest. They still to this day have not really told the public in a real organized way about the difference between the different types of masks. The most effective mask is the N95 mask. Okay, that's the mask that gives you the best protection you could possibly have. Next is the surgical mask, which is what I wear. My sister's a nurse, and so from day one, since the pandemic started, our whole family's been wearing the surgical mask that she wears at the hospital, because she said those are the kinds that work. Okay, so I respect that, and so that's the only kind I wear. What they didn't tell you is that the cloth masks are basically trash. Okay, the cloth masks barely work at all. They are very ineffective, very leaky. And so a lot of people were wearing cloth masks, rushing to get cloth masks, when, you know, again, it is better than nothing, but the public was not educated properly about, okay, you'll do best with the N95 mask, then the surgical mask. The cloth masks are about as ineffective as you're gonna get, and so a lot of people have had to basically take accounting for this. And Dr. Walensky, particularly over the years, has had to eat crow and walk a lot of things back. Who remembers this?
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness.
Let me change
Given that, is it time to start rethinking how we're living with this virus?
That vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
Let me play that one again.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
That was just wrong. That was just false. And so by mid-2020, mid-2021, last year, when people started getting vaccinated and we started seeing vaccinated people still catching the virus in mass, there was an incident in, I want to say Cape Cod, Massachusetts, where there were like hundreds of people who all came down with it at the same time who had just gotten vaccinated. Okay? Now, as you see, she said you won't catch it if you're vaccinated. Okay? You heard Joe Biden say it.
The various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
That just wasn't true. Again, and it was not true at any point. Okay, we saw pretty much from day one, people who were vaccinated were still catching the virus. So then they had to reconfigure and say, well, it's not you can still catch it, but it'll be harder to spread it. But that wasn't true either, because we had situations like, unfortunately, my Chicago Bulls, virtually the whole team caught COVID. And I really do think that helped cost us a lot of games this last season. And one of the reasons why the Bulls did not have a higher seed is because every time they got in a good groove, especially in November and December, one of their stars would catch COVID. Lonzo caught it, and DeMar DeRozan caught it. I think Zach LaVine caught it. Everybody caught it and had to miss weeks of games and stuff. The whole team caught COVID in spite of all of them being double vaccinated. The NBA was 98% vaccinated, and they were having hundreds of COVID cases. The NFL had hundreds of COVID cases in spite of just about everybody. 96, 97% of the players being vaccinated. So then they couldn't say any longer that it will stop you from catching it. It will stop you from spreading it. Then they had to go to, well, it's against hospitalization and death. Which, okay, fine. But now you're moving it into an entirely different realm, because if it's just a vaccine that prevents death and hospitalization, then the choice has to be left up to the individual. Then it is up to me to decide whether I want to get vaccinated or not. You know, and that's the issue that I had here. That's why I'm wearing this mask right now. I made the deal with WLTH. They said if you don't want to get vaccinated, then you got to wear a mask. So I said, fine. That's cool with me. Okay, I know lots of people lost their jobs over this. I know of a lot of people, a lot of nurses have lost their jobs. People in the armed forces, cops. Lori Lightfoot just lost a bunch of cops over there in Chicago. That city's descending into chaos, and they're firing cops because they don't want to get vaccinated. The vaccine doesn't stop you from catching it. It doesn't stop you from spreading it. So what do you care whether people get the vaccination or not? Okay, people are going to catch it. Just about everybody's going to catch it. I'm going to catch it eventually, and so are you. We're all going to catch it eventually. I'm not saying that's a good thing, but it is a reality. We're all going to catch this at some point. Now, thank God we're at a point where it seems to be a lot less potent than it was. And it has worked its way through the population. People have had multiple strains of COVID. Like, people are not dropping dead in the streets like they were in early 2020. I know of about 6 people who died from COVID in 2020 alone. Okay? Like our last caller stated, it was no joke, folks. It was no joke. The first wave was no joke. Let me get this caller. Hello, caller. Hello, okay. Hello, caller. Okay, you know. Well, I mean, look, you can say I'm crazy, but I believe the numbers bear me out. Look at the numbers. 90% of the population is either vaccinated or caught it already. Like everybody, and the people who are, even the people who are vaccinated are still catching it. Some of them 2 and 3 times. Joe Biden just caught it twice. Albert Bourla, the CEO of Pfizer, told everybody to get the vaccine so they wouldn't catch COVID. Well, guess who has COVID right now? Albert Bourla. That's who. Hello, caller.
Hi.
What's up?
Listen, I just want to weigh in on the subject of the
oh, yes.
COVID.
Yes.
You know, in America, that was the first time that they had encountered a disease as radical.
Oh, turn down your radio, please.
Okay. All right. Let me go. Okay. This COVID, this was the first time that America had encountered a disease as radical as COVID was. Nothing had really topped polio until COVID came along.
Nope.
And I think the public was just, waiting for them to tell them what to do. But the officials, they were just grasping for straws in terms of what to tell the public.
Yep.
They didn't know themselves.
They did not.
Because the president set up there and said something about using something like Clorox or something that he thought would work. And I mean, it's not funny, but I mean, oh God, that's insane.
Mm-hmm.
But so happened the young lady, I forget her name, she said no, it wouldn't work. But I'm gonna tell you this, and maybe I shouldn't say this, but I noticed when we got an influx of people coming in from other countries, the COVID went up because I didn't see any of those people wearing masks.
Oh, yeah.
And I don't have to call their names. I think you know who I'm talking about. They flooded I did not now one time see a mask on a child, a teenager, an old person, an adult, anyone. And that's when our rates started going back up again, but no one dare said that. So I just wanted to share that.
I agree with you. Thank you for your call. Look, here's a lot of stuff has been forgotten about the early days of COVID. You know, I think about this relatively often. A lot of things we've forgotten about the early days of COVID. And a lot of it is, like our last caller said, how a lot of it came from overseas. I remember, I know a lot of you may not remember this, but I remember in March of 2020, there was a video made by Italians. Because if you remember, Italy was the first country. Italy was the first country to really get hit by COVID. The first sort of first world country, a rich country. Italy and I think Spain and then France, those countries caught it before we did. So those countries were catching, those countries were suffering, and the Italians actually made a video for Americans called "If We Knew Now What We Knew Then," or something to that extent. And they were warning us because they were saying, the media was saying, and the CDC and all these people were saying, in about 10 days, we're going to be where Italy is. And so the Italians told us what to expect. And they were talking about how they were all out hanging out and they ignored the advice to stay home when COVID first hit. And now all their friends were dying or were in the hospital. We forget how horrible COVID was at the beginning. Like, I was never, contrary to what some people on this, even on this station have tried to pretend, I've never been a COVID denialist, okay? Never. I was never a COVID denialist. What I said was people shouldn't be forced to take the vaccine, especially being the profit motive that all of our public officials and all these people have, and the fact that it doesn't prevent you from actually catching the virus or spreading the virus. It doesn't stop you from catching it or spreading it, so why are we going to force people to get this or lose their jobs and access to society? That was always my stance. But I knew COVID was very real because I saw it in the early days ravage people. You know, young people were really sick. A lot of people were sick. I remember watching the Italians and the Spanish, the Russians and the Cubans. And a lot of these countries had to send doctors to Italy and to France and to Spain because they had run out of hospital beds. They had run out of doctors. Their doctors were exhausted in Italy. And the Italians were warning us like, this is real. This is awful. So, no, I remember how bad this was at the beginning. But the CDC, unfortunately, mucked it all up. All right, folks. When we get back, we're going to talk about probably everybody's favorite villain or hero, depending on which side of the political spectrum that you are on, and his effect on the Republican Party. Please stay with us. 219-885-1371. That number again, 219-885-1371.